In this team mapping video, I'm going to do a quick introduction to personas. I'm Morgan Price, and I'm a member of the ISU. Personas for team mapping are simulated patient cases, and we use those to drive the team mapping forward. Personas are the center of every team map, and we structure our discussions around the persona and that person's healthcare needs. They're designed, selected, or adapted to address local needs and reflect local data. And this way, they trigger relevant discussions across the team. The personas are designed to highlight areas for team-based care, so they're a bit more complex than average. The ISU, along with our community, has developed a diverse library of personas. We're getting close to, I think, 50 different personas that you can use and adapt to fit the needs of the team you're working with. Each persona has a general introduction and then several scenarios that you can use to trigger additional conversation, as well as lots of prompting questions and points and keywords. And so here you can see John, who is a 59-year-old male, and we've put little prompts in there if you can read it, and you'll see it in our library that you can access freely, prompts for local information. And then there are these particular prompting questions and then each scenario. And those evolve the conversation across the team. Second example here is River. She's a younger patient who has additional issues. And so you can use multiple persona. Generally, we like to think of at least 3 with a team to provide a breadth of discussion. And so you can pick them to reflect different aspects of care that you know that the team wants to explore, and the personas can drive that. Sometimes the scenarios feel a little bit arbitrary. You say, oh, well, why did that person suddenly have a shoulder injury? Well, they're completely arbitrary because we've helped create these persona, and it might be that we needed to talk about how does physio connect in with the team. And so we needed some acute and chronic MSK injuries. So we had a shoulder injury as a scenario for a persona. So the personas were built while working with communities and teams. And therefore they have these particular aspects. You can use or not use those different scenarios depending on what works for you. And as the ISU is around, we are available to help all of our facilitators adapt the persona to fit the needs of their community. In the preparation stage, we're going to talk about how to select persona for your teams. Thank you.